Natural ways to lower your creatinine levels. Creatinine is a chemical produced in the body as a result of routine muscle wear and tear. Usually, it passes through the bloodstream, is filtered through the kidneys, and excreted from the body through urination, says Nikola Georgievic, MD, a family doctor and co-founder of medalerthelp.org. As a waste product, creatinine can be used to measure the function of your kidneys, and the creatinine level in your blood is a good indicator of your overall kidney function, Georgievic says. In general, normal creatinine levels are between 0.7 and 1.3 milligrams per deciliter, milligram per deciliter, for men, and between 0.6 and 1.1 milligrams per deciliter for women. However, the healthy range for each person depends on other factors like age, race, and muscle mass. The high level of creatinine in the blood can be indicative of kidney disease. This is because impaired kidney function results in increased creatinine levels, as the kidneys aren't able to filter it out effectively. If left untreated, high levels of creatinine can lead to uremia, a life-threatening condition involving high levels of waste products in the blood. If you have high creatinine levels, your doctor will recommend the best course of treatment to address the underlying cause of your kidney problems. You can also make the following lifestyle changes to lower creatinine levels. 1. Don't take creatine. Your body produces creatinine when it breaks down creatine, a substance produced by amino acids in the body, and also found in protein-rich foods like fish and meat. Creatine helps provide energy to the muscles and is stored in the brain, kidneys, and liver. Creatine is also a popular supplement among athletes and weightlifters to build muscle and enhance performance. High doses found in some bodybuilding supplements have resulted in elevated creatinine levels, though not necessarily impaired kidney function. Still, since creatine supplementation may increase creatinine levels, those looking to lower creatinine levels should not take this supplement. While there are generally few side effects, you may want to get a kidney test before starting a creatine supplement, Georgievic says, and have a doctor recommend a dose based on your kidney function and medical history. 2. Limit intense exercise. Vigorous, high-intensity exercise, like weightlifting or circuit training, can increase creatinine levels in your bloodstream. If you are concerned about creatinine levels, you should discuss less intense workout options with your doctor, Georgievic says. Generally, people with chronic kidney conditions should opt for less strenuous exercise routines to keep their kidney function in balance. This can include 1. Walking. 2. Yoga. 3. Hiking. 4. Aerobics. 5. Indoor cycling. 3. Eat more fiber and less protein. Dietary changes can be helpful in lowering creatinine levels, Georgievic says. In particular, you should cut out dense proteins, like red meat. Red meat is essentially muscle tissue that contains creatine. That creatine breaks down into creatinine during the cooking process, and your body absorbs it when you eat red meat. Eating more fiber-rich foods can also help decrease the amount of creatinine in the body, because fiber helps remove toxins and other chemical waste byproducts. For example, a 2014 study showed a significant decrease in creatinine levels among 143 participants with chronic kidney disease who increased their fiber intake. If you're worried about creatinine levels, avoid high-protein foods like 1. Red meat. 2. Dairy products. 3. Eggs. Instead, try to eat more fiber-rich foods like 1. Fruits. 2. Vegetables. 3. Legumes. 4. Whole grains. 4. Try supplements like chitosan. Chitosan is a dietary supplement most commonly used for weight loss and cholesterol control. Some studies have indicated it may also be effective in reducing creatinine levels in people with renal failure, which happens when your kidneys can no longer filter waste. For example, a 2011 study examined the effects of chitosan on 80 patients with renal failure. Half of the patients were given 30 chitosan tablets 3 times a day, resulting in significant reductions in creatinine levels after 4 weeks compared with the patients in the control group. High levels of creatinine are indicative of a kidney problem, which should be treated in order to lower your creatinine levels and decrease the risk of other complications.